So let me introduce to you Ted Lancaster, who many of you may have heard of or know. I know there are many on here who know Ted personally. Ted is a medical doctor, practicing doctor specializing in the health of those involved in global travel. He's also got a special interest in the health and well-being of communities, and particularly what they're able to achieve themselves. He's worked for many years in some of the poorest villages in India and has traveled extensively. He's also a medical author and a lecturer, and co-founder of this Vuca network that's brought us all together. So Ted, we're going to start off with just a short discussion now between you and I, to kind of frame our time together. So we're really grateful for you and for your role in the network. We're here particularly to think about the future of global health development, aren't we? But to start us off with that, it's important to think about the now. So can you describe to us the current situation, what the world looks like at the moment, and kind of how it's been up till now?
Well, that's quite a question to ask, and to summarize very briefly, I guess all of our situations are very different, and we would all give a completely different answer to that question. But perhaps there's one thing which is tending to also unite us, and it's what I call, and what many people are calling, Vuca. Some of you will have come across this term, VUCA. VUCA stands for V for volatile, U for unpredictable, C for complex, and A for ambiguous. And that seems to describe the way that our world is going. One way we're seeing this, for example, is higher energy prices, higher prices for food and other commodities, more frequent floods and droughts and wars, COVID, and not knowing what the future holds. So communities are being put under a lot of pressure. Far more people, families, neighborhoods, and communities are becoming seriously poor. And I guess that's the context that we have as we discuss this and look at what we might be able to do about it.
Okay, so start us off then, Ted. What's the first thing we can do about this current situation?
Well, let's start with the community. This is often known as an asset-based approach. The community themselves look first at their abilities and ideas before they look at their problems and difficulties. This helps them to identify ways in which the community, they themselves, can best use their gifts and ideas for the benefit of everyone. And everyone, of course, includes the most vulnerable and those living with physical or mental disability. And when a community thinks in this positive way, they can more easily come up with both the problems they already know about, but also the solutions they themselves can use, their own resources, gifts, and abilities. And it reminds me of an anonymous quote I recently heard. If you take any community of, say, 200 people, regardless of how poor, remote, or under-resourced they seem to be, given different circumstances, if they were well-resourced, that community is likely to include a potential country leader, a premier football player, and a world-class actor. In other words, there is a fund, there is a goldmine of ability within each of us and within each community, if only it can be brought out and used for everybody's benefit.
And so you're suggesting they're starting with the community, seeing who and what assets are in the community, which I guess is different from a traditional NGO model where they come in from the outside. When we start with the community, is there a role for people from outside that community who maybe have got specific skills or resources, or does it leave them redundant? How can others help move communities forward?
Well, absolutely. None of us can live as islands, not even communities. We of course need those with special skills and other ways in which we can help. Often these people with special skills are within a community, or in the case of a Vuca, a cluster, or within a neighboring organization, or even people who are known to the community. But we do need these extra people from outside with special skills. There are many of these skills which are needed, and we could list, probably all of us here could list sort of 10 to 20. I'm just going to quickly mention 2 or 3. One is coaching and, if you like, also mentoring as well, which Elizabeth Wainwright has done an L2L on this. We feel this is a really, really important part of support from outside. Coaching enables people or a community to identify its dreams and hopes, its gifts and abilities, which in turn bring hope and motivation. What a great thing that can be. And mentoring focuses more on the specific skills and understanding they need to be effective in their job. So crucially, both mentoring and coaching help to develop leadership and self-confidence, which are 2 vital building blocks of community development. In Vuca, we are able, as you know, to arrange those largely through our friend and colleague Elizabeth Wainwright. And of course, there are many other ways that as outsiders, as outside experts can resource communities. We've got different things on our website. You will all have different ideas on this. We've got what are known as our 12 steps in helping to set up a cluster. We've got parts of our book on community health. So many things like that. But there's one other marvelous way that we can resource each people, and that is by mutual visiting and mutual learning.
Tell us a bit more about that then, Ted. What do you mean by mutual visiting?
Well, let me tell you about something called SALT, good old SALT, S-A-L-T. Some of you will know about this and use it. SALT is a way in which a community or a project spends 1 or 2 days visiting another project or organization or place. They affirm, they listen, they learn together in the context of trust and friendship. They may not know each other before at all. This has worked with great effect in a Vuca network and in the Salvation Army worldwide. So SALT stands for S. S is support, A is appreciate, L is learn, and T is transfer, the transfer of gifts, abilities, help, affirmation between one group and another. And during a SALT visit, organizations share with each other, learn together, get excited together, develop friendships, and nearly always we find that those who've been on SALT visits learn more about what they can do themselves to bring value, new ideas, new hope for their own communities. There's a terrific book on this called Walking with Communities by Dr. Ian Campbell, which is on our website, which you might like to look at.
Yeah, I've got a link for that, which I'll pop in the chat in a minute as well. And there's a really good podcast episode, isn't there, on our podcast about SALT visits?
Yes,
one story from an Indian community about how SALT visits have been so powerful. So we thinking about what communities can do for themselves, how those from outside those communities can help, and then SALT visits between communities. One more question before we move on. What about the government then? Government, aren't they responsible for the health of communities and the health of countries?
Well, absolutely. The government is so essential. And I have to say, quite often in civil society organizations and in our churches and in our NGOs or whatever we want to call our particular group we belong to, we sometimes do not engage with the government to the extent that we really should. It's extremely important. And I would just say we all need to involve, especially the district health team and very often the district medical officer, if one actually exists in our community, because health departments from the top down in a government tend to follow good evidence-based advice from the United Nations, such as the World Health Organization, and they have the policies and the guidance, sometimes, not always, the supplies, which help to resource communities through a wide range of benefits and so forth. So it's very crucial that we do not work separately from the government. We need to work in association as far as we possibly can.
And let me push back on that slightly, Ted. In this world where health systems and governments are really stretched, or in some cases quite weak, and then when local community organisations are feeling stretched themselves, maybe don't have the resources to engage with the government, or are feeling under-resourced, it can feel quite daunting, can't it, to know how to make those relationships work. Any recommendations on first steps that people can take to make that happen well?
Yes, I would suggest that, you know, within a community or within a cluster, that somebody who's got the confidence and perhaps the connections, who will actually ask to see the district medical officer or a member of the team, introduce themselves, explain what they're doing, ask in what ways they can work alongside the government, not in competition, but in collaboration, build that relationship. It may not be with the DMA, or maybe with another member of the team that one happens to get on well with. It may be actually the Department of Education or another department, but some part of government it's really worth making that link with and working alongside. I realize that a lot of health systems are collapsing and are having tremendous problems with COVID, so this is not always very easy, but it's still important. And sometimes a cluster of programs can get together, register with the government, and the government can actually contract out some of the work which they're unable to do to the work of the clusters, and that helps. That works amazingly in one of our clusters in Uttarakhand, North India. And one final thing just to say on the government bit is the community health worker. Community health workers are increasingly working with government. The government's usually set the curriculum and guide communities how to appoint them. And as many of you know and probably use, the CHW acts as the person who goes into the community with good advice, good information, and brings all this into the heart of the community. Can make a huge difference. Many of us have worked with community health workers. They're becoming more and more crucial worldwide. So if you don't use them or know about them, be in touch with us or do some more work on that. Thank you.
Brilliant. Thank you, Ted. Let's pause there. Anything else you want to summarize? Your chance to drop anything else in now, and then I'll leave you to introduce our next panelist.
I just want to summarize what I'm saying because we've said quite a lot. So there are three main things. First, we start with the community and its assets, using them to suggest solutions to the problems they recognize. Second, we move on to what others, such as outside experts or organizations, can do, bringing good evidence and encouragement and good practice and so forth, and salt and mutual learning. So that's the second thing. And the third thing, it's the role of the government and working with them, hopefully also with community health workers. So if you like, there are these three things we need to engage with: community, expert help from others, and the role of the government. Those three things. The Bible tells us a threefold cord is not quickly broken. I would add just one more thing: the value of love, kindness, prayer, and the grace of God. Thank you. We've just got a short period of time to for any questions, any comments, any disagreements. Please feel free to either put those in the chat box. Our next contributor, Munya, will be joining us very shortly. She has to go off to speak at yet another conference shortly. So we've just got 3 or 4 minutes before I introduce her. So please either speak or pop anything into the chat box if you want to just ask a question or say something. Thank you. Your question or comment can be very, very simple, and anything goes. You don't, any idea or any comment is acceptable. especially if it's some experience you've had yourself. While we're just waiting, I would just encourage everyone who's listening to think of ways in which they creatively move a little bit further forwards in what they are doing themselves. Thank you. Did somebody say something?
Yes, Ted Dennison here from Bihar, India.
Hello, Dennison. How nice to see you and hear you. Thank you.
We know very often the government strategy has been top down, and where the policies and strategies are designed by the bureaucrats. And increasingly, the large NGOs also seem to be designing things from their office rooms. Of course, we know there are a lot of researches going on, and they pick up a lot of evidences from those researchers. But then where you said to start with the community, that is something is not there in the planning. There's a lot of research studies, evidences, but the strategies are from your office desktop. How do you do that? I mean, how do you see that?
Well, I'm afraid that part of the world, or a large part of the world, is still done in this sort of top-down mentality. You know, the government says, and everybody does exactly what the government says, and the community is not necessarily listened to. It's just told what it should do. And, you know, we can all lament that, and we can all wish it wasn't like that. And of course, some governments are so dominating, it's very difficult to actually speak to them. But I do believe that the more communities actually engage with the government, even at a local level, sort of the district level or community level, the more the government will realize that the community is part of the whole program. So I think we need to make continual friendly overtures and discussions with the government so that they realize that the community has got good ideas and wants to work with them. So it's not entirely the government's fault. I think it's partly the fault of communities are sometimes doing a little bit too much on their own. Thank you. Just got time for perhaps one more quick comment. Thank you for that, Dennis, and bless you.
Hi, Graham Fawcett from Thrive. Just been working with quite a number of large networks of organizations, and the key message that came out of that was, in a way, the need for a new kind of donor conference. So in other words, where the small NGOs in particular are too fragmented for government to listen. But if 60 or 70 or 100 or 1,000 NGOs got together in a room, but they were the ones on the platform and the governments and the donors were listening, that could have a different kind of impact. And I'm finding, as I'm talking to people in various parts of the world, enormous appetite, but no idea how to organize that. I think a slight fear that they may not either have the capacity or the ability to do it. I'm just wondering whether that resonates at all.
Thank you, Graham. That totally, completely resonates with me. I think the government is already so exhausted, and everything is so complex and volatile that they can't possibly get to know every NGO, even large NGOs. So they're coming together. In the UK, we've got worldwide, there's an organization called the CHS Alliance, which is trying to do that. But I think we all need to work towards the coming together, the collaboration of different groups to talk to the government. That would be far more effective. So Graham, yes, let's all continue to think about that creatively. Thank you. I'm sorry to break this up, because we could go on discussing but we're hugely looking forward to the wonderful Munya Matarusi from Zimbabwe, who's going to speak next. Munya describes herself as a development worker, a trained social scientist. Her current position is Senior Programs Officer with the Evangelical Fellowship of Zimbabwe. She also works closely with Tear Fund. Munya's passions are governance advocacy, so a lot of what we've just been talking about, and working with communities to influence citizen agency and engagement. Munya, we're hugely looking forward to learning from you. Thank you. God bless you.
Thank you so much, Ted, and a very good morning to all of us. I am coming to you from the city of Harare. It's a very cold winter morning here, and it's good to be part of this conversation. I was intrigued as you were going through your question and answer session, Ted, because I thought, well, you are looking into most of the things that I'm hoping to share on this platform today. So I work for an organization called the Evangelical Fellowship of Zimbabwe, and with this institution, we have been implementing a flagship program that we call social accountability, but it's really couched within a much broader context of our programming, which is CCT, which basically refers to church and community transformation. And I think it is within this program, I'll speak a little bit into how our advocacy work relates particularly to the CCT work. So CCT is essentially what you were just talking about, Ted. It is an asset-based approach where we are coming into communities and allowing them space to reflect on their own communities, identifying available resources, and also identifying what they think are their common challenges and problems, and then making use of the available resources to deal with those problems or to respond to their challenges. So that's basically what CCT looks like. But what we've been able to do in the last couple of years is to introduce advocacy into CCT, which was something that was missing, I think, for a long time. I think advocacy then answers the question that you were talking about. What outside help can we provide to communities? So in our view, CCT is our assets-based approach in communities. And then the introduction of advocacy, particularly through social accountability, answers the question, what outside help can communities get? In our view, or in our instance, we are then coming in as an organization to provide support and build communities' capacities in advocacy. And because advocacy is so broad-based, our focus is mainly on social accountability. As a development concept, our understanding of social accountability is that it is a tool that communities can use to help to strengthen relationships that are constructive between themselves and their service providers or solution holders, and in this instance, the government. So we're also introducing the concept of what is the role of the government that you were just speaking to as well. Social accountability has proved to be a component of advocacy that works quite efficiently in communities because they can immediately relate with some of the tools that we introduce to communities. And communities, once they're adequately empowered, are able to actually move forward with using social accountability as an advocacy tool on their own, with very little technical support that we provide them after we've come in to provide the training. So I'm just going to quickly run through the different components of this intervention. So we begin whenever we enter into a community by envisioning the community. So we get together the church and community members that are not necessarily identifying themselves with a church. We get together and we share, if you will, the vision of what social accountability is and what it is meant to benefit a particular community that is interested in engaging with it. And once we are done with the envisioning, we also make sure that during that time, we engage our solution holders. So we envision communities as well as solution holders at the same time, so that no one is caught unaware or feels like at some point during the implementation of the intervention that they are caught unaware and they didn't know what was happening. For us, it is very important in the context in which we operate in because the state plays a very huge role in how communities set up and particularly in the provision of basic social services to communities. So once we've done with the stage of envisioning our communities and our solution holders, we then provide extensive training in social accountability. As an organization, we have developed training manuals that we at the end of each training we provide to our communities. We call them the community members would have trained, we call them community champions or social accountability champions, because once we're done with the training, they are basically responsible for all the other offshoot or follow-up actions that should happen with social accountability. And we provide support kind of remotely thereafter. So once we've trained our social accountability champions, we also leave them copies of the manuals that we have developed as an organization for constant reference and guidance as they implement or as they endeavor to exert accountability in their communities. So once we're done with the trainings, and towards the end of the trainings, each community will, because the training offers a variety of social accountability tools, and a community would have to identify what tool works for them the most within the context of that particular community. And almost always, not almost always, in fact, 100% of the times, and we have done this in about 15 different districts in the country now, communities always feel the most comfortable with the community scorecard as a social accountability tool of choice. So all the communities we've worked with introduce social accountability have always chosen the community scorecard as a tool. I wish I'd had a copy and I could just quickly beam it for people to see what it kind of looks like. The community scorecard is basically a tool that communities use to harvest citizen perceptions or thoughts about thoughts about a particular social service. So it could be the issue of health, it could be access to water, it could be access to roads. I guess in the context of our conversation here, it would be around health issues. So communities will develop specific questions that they put on the scorecard and then they administer in the communities. The questions are always guided by what we call the triple AQ framework. So we're asking questions around accessibility of a particular service. In our instance, it would be health. So about accessibility of health services, about availability of the services, about affordability of the service, and the quality of the service. So the questions are always couched within the triple AQ framework. Once the community champions have developed the scorecards, they go into communities, they administer. The idea is to harvest as much information as possible and from as many community members as possible, so that they then develop a report which they use to engage. So their community scorecard report becomes their advocacy tool, which they then use to engage solution holders. In our instance, health is always provided for by our government, and we're working particularly at a local level. So our local authorities are the ones that are responsible, our service providers or solution holders in this instance. At the point of engaging the state, the idea is always to make sure that communities come out of that engagement with commitments, shared commitments. First of all, a shared understanding with their solution holders about what exactly the problem is, but more importantly, what the commitment is from both the community members as well as the state in terms of what they're going to do to improve or to work towards improving that particular challenge. And in this instance, it would be access to better health services. But what is more important is that the champions have to go back to the communities and feedback. We always make an emphasis that our intervention is not extractive. We don't just go into communities, get information and kind of just go away, but that champions have a responsibility to go back to communities and provide feedback in terms of the engagement they would have had with the state. More importantly, they also organize themselves internally and identify a team that's responsible for follow through on the commitments, on the joint commitments that would have been made during the engagement session. And so the story goes. We've got a variety of examples we have documented as an organization in the different communities we've worked with about where this has worked well the most and what have some of the results been. But based on our experience in the last 7 to 8 years, we are confident that social accountability is a tool that communities can use to really begin to exert accountability, but more importantly, I think to use to influence a changes and improvement in the delivery of basic social services. And I think in the context of our conversation today, it would be around issues of health. So yeah, that's my long and short of it this morning. Happy to respond to questions or any interventions. Thanks, Ted.
Monia, thank you so very much. Just before anybody else comes in, that was really, really incredibly interesting and yeah, creative thinking. There were two things that you said which I really loved here. One is you've got a method of enabling the support systems of all different sorts to be available to the community through this whole training package that you describe, and not only to know about that, but to have this genuine engagement and backwards and forwards and inclusion of everybody in the advocacy, and then that same link with government, that not you don't just talk to them, but you actually make an agreement. So it's a way of sort of formalizing what a community can receive from outside, and also the way that a community can talk to the government. So it's to some extent it's sort of a methodology for the things we talked about this morning. We would love to know more about that, and we wonder if you are able to share some of that for us to pass on to others. Can I leave that with you and Tom, perhaps, to arrange that? Because I just have a hunch you've got a very special tool here, an empowerment tool for communities, really, which would be very valuable. Thank you for that. But we have a question here from Andrew Tompkins, which I will just read out. Andrew is Professor of Child Health, University of London. Munia, that was a great presentation. Where can Vuca members read your evaluation of the impact of social accountability? Yes, indeed. So that's what we were just talking about. Thank you, Andrew. Good.
Ed, can I jump in and ask a question?
Yes.
Hi, Munia, thanks so much for that. Can I just ask what challenges you find trying to envision people about this, or the need for training? I just kind of think of some communities that are fairly scattered. They may know they've got needs, but the transition from kind of knowing that there's needs to beginning to mobilize, and I guess that's kind of part of the role that you do, but what are some of those challenges to try and get a community to have some energy to, on top of the hardships that they may be facing, to actually think, if we came together, we could do something? It sounds great, the training package and the method, but I can't believe that it's always easy to have communities mobilized in this way.
Thank you so much for that question, and you are absolutely right. The challenges are many, but also very similar in a lot of the communities. Maybe let me quickly describe our context a little bit. So we work mostly in rural areas, but we also implement this intervention in urban areas, but not so much. I think it's largely in rural areas. And there you will find that we don't have a challenge in fostering community cohesion or social cohesion in rural areas. But the challenge then comes through with trying to convince communities that they could actually be agents of change and agents of fostering real and meaningful relationships between themselves and their solution holders. There is always the biggest challenge. That's why when you look at the way we implement our intervention, we spend a lot of time on envisioning, because we can't move to start training individuals before they understand why it is important for us to have this intervention. And so our envisioning is not usually a one-day process where we get people together, we make a presentation and everyone is like, yay. It's usually, a variety of meetings where we're going back and forth with communities, and eventually, but what we found has worked is that this intervention is couched and it is championed by the local church. So Zimbabwe is a largely Christian community. I think in our population, we have about 85% of our population is Christian. So there's a level of believability that even I can't explain that the community has with the church. So it will be the church that then leads the conversation to try and convince community members about how useful this is. And I think the trick with social accountability is that communities only begin to strengthen their faith in it, their confidence in it as they implement. So it's not good enough for us to just come in and train, but once we have trained communities, they need to begin to actually start to see the change. And for us, the change, or at least from the context or the perception of the community, the change has to translate to actual changes in service delivery. If a community had trouble in accessing water, they have to, at some time during the implementation of the intervention, they've got to start seeing that. So you're absolutely right. For us, I think our biggest challenge is always convincing communities to understand that they actually could be agents of change, that citizen agency is what they need to drive change in their own communities and to actually influence effectively development that matters to them and that actually makes sense to them. So the beginning of the process is always the most difficult for us. But we found that because social accountability works in terms of seeking for responsiveness from the state, communities begin to gain confidence as we implement, because they slowly start to see that, oh, okay, so when we started, we didn't have access to clean, safe, potable water in our communities, but all of a sudden, we're not getting it every day, but we're starting to get water once a week. And okay, so this thing actually works. And they actually get more people involved. They become the agents of change. They become the influencers in their communities. And we are now just providing support remotely. I hope that answers your question.
Thank you, that's helpful.
Just to comment on that, thank you, Monia, so much. I do love this concept of the agent of change, that any person in any community can become an agent of change. And they just need the confidence to realize that they can do that. And that is the way forwards for so many communities, to realize that their members can be these agents of change. It's a word for us all to take away and think about. Thank you very much. We've got time for just one more comment or question before Munya has to rush off and speak to another group of people. Have you got another 2 minutes left for us, Munya?
Sure.
Any other questions for Munya or comments?
Hello. Hello.
Yes, carry on.
This is Angela from Zambia. I'd really like to appreciate your presentation and sharing, Munya. I think for me, this is a great learning point, that advocacy has been the missing component in our community strategies, because communities, from what I'm learning now, it is good because the community has a tool, a written document, written facts that they can use in their advocacy. In the past, maybe the community health workers, as we work with the community, we would just say, no, we've seen so many people with such a condition. Can you bring a borehole maybe? So for here, for this one, communities are having a document that they make themselves, not a researcher from outside, but some research that they have personally done, and at the end of the day, they are the ones to evaluate and see the goodness, like you have said. When they see these things now changing, they know where it began from, and they know how to go about it. And above all, I think it's good civic education that communities learn how to hold the state or our leaders accountable. Thank you so much.
Thank you. Munya, do you just have just for 1 minute, any response to that?
Yeah, I think Angela summed it up quite well. I think what at the heart of the success of the social accountability intervention is that communities are able to provide evidence-based advocacy. So it's no longer just 5 people coming together and saying we've got a challenge with our healthcare system, our polyclinic or our district hospital. It's community members addressing or engaging their local authorities or service providers from a point of evidence where they're saying, but it's just 5,000 people in our communities have been having challenges with accessing health or with the quality of medication that they're getting from a healthcare center and so on. So yeah, it's the evidence, I think, that has allowed for or pushed for state responsiveness. In this intervention. I think she summed it up quite well. Thanks for that, Angela.
Thank you very much. Just before we say goodbye to Munya, just to let you all know that I'm sure, well, I hope all of you know that Tear Fund produce an absolutely amazing magazine called Footsteps. Please get in touch with the details of how you can obtain that or see it online if you don't know, and we'll put some details up in the chat box on that. The next edition in September is on the topic of community-led advocacy, and Munya is one of the people who has written an article for that edition. So strongly recommend that you make sure you regularly get Footsteps, and especially this particular one coming out in September. Munya, thank you so very much for your contribution. God bless you if you go on to your next session now, and it's been just wonderful having you with us. Thank you very much.
Thank you so much. Thanks for having me, Ted. Thank you, everyone. Have a good day.
Thank you. We now have the great joy of having Dr. Sidevi Angami to lead us in the next session. Dr. Sidevi is a physician and gastroenterologist. His current position is the director of the Christian Institute of Health Sciences and Research, which is a combination of a hospital and a nursing and medical training center in Dimapur in Nagaland in northeast India. And Sidevi's passions are facilitating people to reach their God-given potential. Love that. Networking people to connect the resources to identified needs, and facilitating the church to demonstrate the character of Christ to society. So Debbie, thank you so very much. We look forward now to hearing your wisdom. Thank you.
Thank you, Ted, and for everyone who is here on this meeting. It's such a privilege to be here, and I was just looking at the participants and looking at the wonderful organizations they've been coming from. And I thought, wow, this is a gold mine. I'd like to really listen to the stories from all these wonderful people. So I thought I would share, I'm first a disclaimer. Like Ted said, I'm a physician. I'm predominantly a hospital-based person. Hospitals, like you know, are firefighting places, you know, where we deal with symptoms and things like that, which should have been taken care of in the community. But that's where I am. But I do have a passion for community health and public health, though I can't call myself an expert. So I would like to start by sharing some of the mistakes that we made in community health. We have a Department of Community Health, and we're quite passionate about it. But I thought it'd be useful for, you know, some of the learnings that we have. We often go into the community looking for problems, which we can solve with solutions that we have acquired from various very legitimate sources and our own experiences. And quite often, many of these are based on our assumptions. And often though they are quite legitimate, they can be quite simplistic and naive. So quite often it's like many sicknesses are due to poor hygiene, and therefore the answer is to wash people with soap and water, provide basic sanitation, which sounds very good. Or tuberculosis is caused by a germ, and therefore treat them with 6 months of medicines, educate them about the disease, and you'll take care of the problem, and that's what the national program does. And this all sounds logical, but our experiences have been very different. And so I'd like to just give you a few examples of what we did wrong. So we had sent a small team of our nurses and a small team who went to Myanmar to do a mission trip, and they were armed with quite a lot of goodies, and they were also inspired by a very reputed Christian physician who had been working in community health for many, many years. And he said, when you go there, teach them basics of hygiene, sanitation, and things like that. Don't talk about some very high-end things. So they took a lot of soap and all that they could and went there, and they did their work in Myanmar. And then they washed a lot of the babies there with soap and water. They took lots of nice photographs. And what happened was actually the babies and the children who took a bath, their lives became miserable. Because prior to that, they never took a bath for many, many years. And their skin was caked with very thick dirt. And so it protected them from insects. So after they were washed, the insects started biting them, and then their lives became miserable. So I thought, my goodness, we thought we were doing well. A friend of mine, again in our network, he went to Myanmar, and he thought, oh, these guys need toilets. And so he built lots of toilets for them. And he was very disappointed later because he found they weren't using the toilets at all. So he had to really, cajole them and blackmail them, saying, if you use toilets, I will give you solar lamps and things like that. But this is one of the problems which we have in our country, where the government has introduced a huge number of toilets, spent millions of rupees, and not able to get people to use them. In our community health department, we work in a block in our district, and for about 10 years, we've been doing a lot of good things: immunization, reproductive and child health, mobile clinics, house-to-house visits, trainings, and our people are community health experts. So they do the usual, participatory rural appraisals, focus group discussions, and things like that. But when I asked them, I said, see, we've been working for the last 10 years. If we move out, will the work collapse, or will it continue? And the head said, I think it will not continue. It will collapse. So I said, then what do we need to change? Because here we had people who were extremely well trained, but still then things were not what it should have been. And what we realized is we had not generated community ownership. And we didn't have enough names of champions, health champions out there who would continue to do the work after we had left. Some years back, my predecessor and I went to a village, and we were talking with a group of people, and we talked to the headman. And my boss, he asked them, he said, what do you think causes tuberculosis? And he said, when you're young and you get beaten up by the Indian army very badly, when you grow old, then later you get tuberculosis. So this was a revelation, because then I realized, my goodness, if we give tuberculosis treatment, he's not going to take it because his perception is different. And so I realized the massive gap that was there between what we were planning to do and what they perceived. I had some fairly good relationship with the MSF, who worked in Nagaland for 3 years. And they took on a very remote district in Nagaland. They took charge of an entire hospital from the government, and they did excellent work. They had sacrificial intentions. They had very good people from across the world, excellent protocols, infrastructure, skills were superb. The supply chain, everything was excellent. But at the end of 3 years, they had to move out. And what I realized was they had created dependency and very nice memories. But actually speaking, things did not continue after that. So it was 3 years of very good work, but not sustained. So what was really wrong with our strategies? I feel that what we felt was that we felt we knew the answers, since we were educated, we knew from stories across the world, experiences, it's worked elsewhere and therefore it should work here. And we were really not listening enough. We did not really create community leaders or community ownership amongst people who would find their own solutions based on their own experiences, observations, and knowledge. So we did things for them, and we did not really tap onto their strengths well enough. So since then, my understanding and the manner of our working has changed a little bit, and it's still changing. We're trying to evolve into this. One thing which really helped me was, of course, Ted's first book, that setting up the community health and developmental programs. That really influenced me initially. And a few years back, I noticed that there's a lady called Grace here from University of Cape Town. But there's a Dr. Steve Reed who came from University of Cape Town, and he introduced to us this concept of the leading causes of life by Gary Gunderson. So when you go into a community, don't look at the problems or what are the issues, but really look at what causes or generates life. So he called it the leading causes of life. So they were like connectivity, agency, hope, coherence, and generativity. And this I found really fascinating, because I realized we were doing, we were looking for problems. And if you look at problems, it's endless. The world is a wicked place, and ever since Adam and Eve ate the guava, things really worked out, so bad. So chasing after problems is like an endless thing. Whereas if you're looking at the strengths of people, understanding that God, there is the image of God in these people, and the image of God is got fantastic potential. And if we can work with that, then there's a winner there. So we realized that we need to really work in partnership with the Lord, respecting the image of God in the people that we work amongst. And that would be much more different, because then you would not lose. You can't lose in that situation. If we're trying to deal with problems, we may or may not get there. But if we're relating with the image of God in people, then I think we can show progress. So this has helped me a lot, and ever since I started learning a little bit about coaching, I realized that this aspect of coaching communities, even in whether it's urban or rural or even amongst our staff, this is something which is really important. And I've learned now that we need to stop giving advice and listen more to the stories that people have. Like I personally don't spend too much time in the community, the rural community, but amongst our staff and in our society at large. So just an example of this, of listening is, recently our church has started a small feeding the poor program, and we go to the railway station and give food packages. And while giving the food packages, I was looking at the people there, and I thought, wow, immediately I thought, okay, what's the next thing to do? I thought, we should start a rehabilitation program for these homeless people, get them to the hospital, get them employment, get them clean clothes, shelter, etc., etc. And my mind started working quite fast. And then I realized, hey, we stop, don't go so fast. First, listen to them. So I started sitting with them and then listening to their story. And what I realized was, these people, some of them had been on the streets for the last 15 years. And they seem to be okay. Then I realized, this guy has survived for 15 years, which means he has enormous survival skills, which I don't have. He has resilience, which I don't have. He has things which, he knows, he's street smart, which I don't have. And therefore, these are, tremendous amount of skills and assets within the people here. And then I thought, well, we need to, when we're planning on what next, we need to really work on their strengths rather than the problems that they seem to be very apparent. Recently, our institute, our hospital, we've been trying to work with various people. And one of the things we thought was, if we want to make an impact in health in Nagaland, we need to find out where are the good people all over our state. And suddenly, a big officer in the police came and said she wanted some help from us for concessions in health. So we said, we'll give you that concession for healthcare, but we would like to be involved more. So I told her that we would like to be involved with your police people, because your people, I've got ulterior motives. Your guys are situated in all the remote corners where we are not, and they know situations which we do not know. And therefore, we would like to be with them. We'd like to, of course, train them in healthcare and things like that. Maybe they're nurses, they're doctors, and things. They're cadres. But what I told them is, see, we would like to look for people who are good in your community, because I'm sure you have some really good superstars, and we want to link up with those guys, and we want to invest heavily in those guys, make a good relationship with them, and then support them wherever possible. And if we look at what are the problems in the police force, the health problems and things like that, it's manifold. Tuberculosis, HIV, drug addiction, alcoholism, etc., etc. So many. Of course, we would need to relate to some of these, and also, corruption and misappropriation of money and things like that. So we realize that if we're going to look at problems alone, we will be just banging our head against the wall and facing lots of barriers. Whereas if you're looking at the good people amongst them, and there are good people, and we need to search for them, then I think we can work with them. And in the process, all the other problems, slowly, we might be able to relate to them. So in the same way, we will be working with a church organization, and which is quite a healthy organization. Again, they came to us asking for help. And we said, no, we won't just come and help you. We want to listen and learn from you. And we want to identify your strengths. And they are very good community strengths. And therefore, we would like to, capitalize on those. When we're also trying to get into school health, partnering with several schools. Again, we have ready-made programs, but we realized that we should not start these programs because we've done it in the past, but now we would rather identify the good guys out there amongst the schools, champions who then we can invest and relate with. And so, so those are some of the things which we are embarking on. Still a lot of things work in progress. What we realize is that in all of these things, there's this great potential amongst people, which because God's image is in them. And when we look at that, the image of Christ within the communities that we work, whether it's police or schools or villagers, then we've got something really exciting with which we can work with. So that's a little bit about the kind of things that we are observing, and still a lot of work in progress. Thank you.
Sadevi, thank you so very much for all those ideas. Whenever I listen to you, I hear of amazing stories and new ways in which you do things. And I love what you've just said. Rather than summarize and say more myself at this moment, just 5 minutes for us to respond to anything that Sadevi has said, any comments, any experiences you've had which may reflect a little bit of what he has said amongst the people he's working with. I would like to hear of other people's ideas about looking at the image of God within people, the inherent ability within people to make, to do good things and be, if you like, community champions. rather than just to those people who recite all the problems they've got. In other words, moving, as we were saying at the beginning of this session, to the abilities and so forth and so on. If anybody's just got anything a little bit further on that or any other topic, that would be great to hear. Here's a question from Anne. Thank you very much. In what ways do you go about discovering community-based assets present amongst the people? How do you discover these assets? How do you come across these community champions? Any thoughts on that?
Yeah, like I said, I'm not in the community continuously. When you say community, it could be community within our hospital, community in the church, in the society, because ours is urban, but our team does go to the village. And very often what they do is, they do what they call resource mapping, like identifying the kinds of resources that are available, whether it's infrastructure, manpower, profiling people, and trying to understand who are the good guys around. And then, of course, talking with them, they do a lot of this participatory appraisals and talking with people, listening to their stories. So that's part of the way by which they look at identifying community-based assets. I find, whenever I squeeze a bit of time, I like to talk to people and listen, because I find people fascinating. So as soon as I meet anybody who's not a medical person, I immediately jump, because I'm 95% of my time in the hospital. So immediately I jump and I get all excited and I ask all the questions about their life. And then I say, you are so interesting, please tell me more about yourself. And so that's one way that I go about, trying to find out about the assets, and then how, and as soon as I find out about somebody who's interesting, one of the things which I realized, which actually Ted gave me this advice a long time back. He said, could you link a person from your cluster to another person, who might have a resource or something like that. And so that's what I've been trying to do. Say, you look at one person, he's got something interesting, and you look at another person in the cluster, and I quickly try to match them and say, hey, this person is so interesting, you must quickly meet him. And so I try to match them. Yeah, so that's how we try to network people.
Thank you. That's wonderful. I love that. And I love the way that you listen and engage with people, develop those friendships. And then when that happens, all sorts of things can arise from that friendship. And that helps to affirm people and to believe in themselves so that they can become agents of change. They can become these community champions themselves. Thank you. Any other comments from anyone before we wrap up? We've just got another couple of minutes when we can share ideas.
Our experience in Laos was very similar, but it does take time, and you just have to spend time building those relationships. And you see people who will rise to the top, and they're the ones that will make the change in their community. And often they're not the ones we always recognize right away, but over time, and building their confidence and their just giving them an opportunity, and then you see ones that will change their communities, and that's really exciting to watch. But it's not a quick process. It can't be done by one visit to a village or something, or one visit to a health center. It takes a long time, and it's slow, but it's worth the effort.
Absolutely. Yes, thank you, Anne, for that.
Ted, can I drop in a question that came up earlier in the chat, but Sadevi, you mentioned coaching. I know you're a great advocate of coaching. Koek asked earlier what the difference is between coaching and mentoring. I wonder if, Sadevi, just in your experience, I know that they're quite similar and there's probably a lot of overlap, but what's your experience of coaching and maybe how's that different and how's it helped you?
Yeah, coaching is something which I learned quite late. And this is something because I thought I had a lot of experience, knowledge, books that I read, videos that I saw, people I met, things like that. And the sum total of all that was a lot of useful information, which I thought will be useful to others. But what I realized is in the process of trying to communicate this to people and give advice, it often disempowered people. It didn't generate the results that I wanted it to. And it didn't really always inspire people. It possibly gave a lot of information to people and maybe also even overwhelmed people, overloaded people. And so recently I started learning about coaching and I realized this is a much better way. This is more of, helping people to clarify their thinking, helping them to grow, reflect, become more precise in their thinking. And the process, I think, is excellent. And I thought this was something new until I realized almost everybody is now on coaching. So I've been using this now method amongst all with my staff, my children, my wife, everywhere. So I find it produces much more results. It is much less of a strain on me. I don't find that I need to give a lot of advice, and wait for it to take effect. I find that coaching is a wonderful way of getting people to produce more and do things on their own. And they feel that it is their own rather than me imposing or inserting it into their mind and things like that. And it also respects the dignity of the person in front of me. So I find that this is something which is really useful. And I'm sorry, I should have learned this 30 years back. It would save me a lot of trouble.
Thank you very much indeed, Sadevi. That's wonderful. We're going to need to wrap up in just a moment. I'm just going to make one or two very quick comments before handing us back to Tom. But a huge thank you to you, Sadevi, and obviously to Munya as well, and also to other people who've contributed. I guess we will all have taken away particular messages, ideas, thoughts today, and we all have our own list. I've taken away loads, and I'm going to have to reflect on them. And when we hear something and we reflect on it, we then need to go back and make sure that becomes part of who we are and what we do, rather than just sort of bounce off us. So perhaps we all need to do that. I'm thinking about realizing in every person there's that God-given image, that almost any person, whether they're living on the streets or whether they're a senior police officer or whether they're a vulnerable person with mental health in a community, they have all got something they can particularly contribute. And all the time thinking about the assets and the abilities and the gifts, rather than being overwhelmed by all the problems, because you need to put the gifts and abilities before the problems always. So we take all these ideas away. Thank you, folks, very much indeed. I'm going to just hand back now to Tom just for a few final comments before we wrap up in a couple of minutes. Thank you.
Thank you, Ted. Just a couple of closing thoughts from me. I won't add any more. As Sadevi said, what a gold mine of people on this call. So thank you so much, everybody, for joining us. Thank you to our contributors. Thank you for the questions and the comments. What an amazing conversation. As I mentioned, this has been recorded and we'll pop it up on our YouTube as soon as we can. And I've made a note of lots of the resources and links and questions that have come up in the call, and I'll put those together as much as I can into an email and send out to everybody at some point in the next few days. I just invite you to comment back in that email to me if you can, on your thoughts on this session, if you'd like to be involved in future ones. Maybe there'll be others on the call now who might be willing to contribute on future topics. If you've got any skills or wisdom or experience, stories that you feel able to share that would benefit the network, please do let me know about that. And the other option, if you consider yourself as one outside of these communities we're talking about, but would like to continue to be involved, then we'd love you to become a friend of Aruca. So there's an opportunity to continue to be involved in these calls and in the network, and support us financially too. You can find all the information, if that's appropriate for you, on the website. Now, we're a Christian network, and we've mentioned people being made in the image of God lots in this call. That was so helpful. It adds extra depth to the value that people have, doesn't it? And just to finish us off, let me finish us off in prayer to end our call. Let's pray. Lord God, we thank you so much for our time together. Thank you that we can be connected like this across the world. We don't want to take that for granted. Thank you too for who you are, and your heart for people, that you made people in your image and that you care for them. Thank you for the opportunity you give us to reflect your heart to our communities and to care for them too. Help us to keep valuing the people that you've placed us amongst, and to help them to help themselves. Give us wisdom as we do that. Give us wisdom as we connect together, and seek to connect to helpfully impact global health and development. Thank you for the privilege of being together and learning from each other. May this continue. In Jesus' name, amen.
Amen. And Tom, just very briefly, how somebody's asked how can they see the video? What's the way of seeing the video?
So it will be on Aruca Network's YouTube channel over the next few days. So you can go onto YouTube and search for Aruca Network. I'll also send out an email to everybody I have on the attendees list with that link once it's available. If in doubt, then email me on tom@arucanetwork.org. And I can send you the link. That was tom@arucanetwork.org. Thanks, Ted. Great. Thank you, everybody. God bless you.
Thank you. Bless you all.